Can you tell me how you got into gynecologic surgery?
So, it's funny. That's a funny story, actually. So when I finished medical school, my dream job was to be a maternal fetal medicine specialist. And I wrote my personal statement to that effect as I was applying for residencies. And after about a year of doing OB, I realized I don't like OB very much. And then I kind of I just enjoyed my surgical rotations, and I had and I was always got good reviews in there. And so then I was I was doing a military scholarship. And so then they were able to offer me the opportunity to do fellowship through the military. And the urogynecology came up, and I loved vaginal surgery even as a resident. And so there I went. And the real funny thing is when I was finishing up my chief residency year, I don't know, probably don't do this so much anymore, but there used to be a roast for the residents, and sometimes they got a little bit ribald. Well, my roast was our program director reading my personal statement, because by the time I finished residency, there was absolutely positively no way I was going to deliver a baby ever again. And so anyway, but yeah, that's basically just an interest. And then, being given the opportunity through the military to be able to pursue fellowship training, and it worked out very well.
I love that. Actually, I don't think that they roast anymore.
No, probably not.
But I was still of the generation. I went to residency 16 years ago.
Yeah.
And we did roasts. And I have a similar story in that all my letters of recommendation for residency actually were plastic surgery letters, because I changed at the very last minute. I was going to go into plastics.
I mean, you're doing some version of plastic surgery now. So.
Yeah, sure. But they read my letters of recommendation that said that I would make an excellent plastic surgeon, which was funny.
Right.
So in your interest in gynecologic surgery along your way, who has mentored and sponsored you?
So from the perspective of SGS, certainly Dr. Jeff Cornell was probably the most influential, because basically he told me when I was a fellow, handing me the application, Andrew, you're going to join SGS. And there wasn't an ask or a reason why. It was just here. And so I definitely have to thank him for both the surgical training and for that modest nudge in the back. And then, and then in addition to working with Javier Magrina at Mayo Scottsdale, just to learn, to watch somebody who's a true expert in every facet of surgery, and to learn from that, to work with Dr. Paul McTeeby, who was a year ahead of me in fellowship at Mayo. And again, to see somebody who was just incredibly dedicated to the craft of surgery. He was probably the only person on the planet who was absolutely lunatic enough to do both a urogynecology and then subsequently a GY oncology fellowship. And while I'm not that crazy, I did learn that the perseverance to press on with your education regardless. And then, probably my biggest shout out will go to my old, he was, how do I say it? He was Dr. Maddox, Dr. Michael Maddox. So he's not academic. Nobody would know who he is, but he was one of my attendings when I was a resident, worked at Kaiser, just a great surgeon, was kind of the urogynecologist, back in the day when there weren't many urogynecologists. After I left, he ended up doing fellowship in urogyn to pursue further education while I was doing fellowship. And then after I finished fellowship, I was able to then got the privilege to be able to join him and then work with him until he finished his career about 7 or 8 years ago. And what he taught me, both as a person and as a surgeon, those lessons, I'm choking up a little bit here. I'm so grateful to have that opportunity to have had to work with him. And,
there is no one that I've had interviewed so far that hasn't had sort of these similar experiences with this lineage of people that have contributed so much. But especially those the ones that aren't obvious, I think, are the ones that a lot of us want to hear about. So I'm glad that you had somebody to share.
And then also one other shout out, just in terms of SGS, would be, really developing what SGS was to what it is, was getting to be on the ground floor working with Nancy and Lenny. I mean, I don't, the difference in the organization that they were able to make was just, and help in, the good news is they helped us along to develop the organization. And that was a fantastic opportunity as well. It was really, really sad to see them go. They were such a phenomenal group to help us become the organization that we are today.
I think a lot of people feel that way also.
Yeah.
You're in good company.
Yeah.
What to you makes a good gynecologic surgeon or a surgeon in general?
So I actually wrote an article about this for OGS many a year ago, and so it's intelligence, the ability to see things and translate them into motion, the ability to feel where your hands are in space, so visuospatial recognition and somatosensory perception, and then being intelligent, and those two things are measurable outcomes. And then there's the sort of the non-measurable outcome, which is, and I like to contribute. I like to call it being anal or compulsive. So I always tell my patients, if you like me, I'm anal, and if you don't like, or if you like me, I'm compulsive, and if you don't like me, I'm anal. And my wife generally tends to think of me as anal, and but it's that attention to detail and the never being satisfied with how things are, always working to better yourself, make yourself a better surgeon, because ultimately it's truly our privilege to be able to operate. And we all should be, every day that we walk into the OR, we need to think of that, right? Like, this is, it's an honor for me to be here, and I need to honor my patients by being the absolute best possible surgeon I can be at every minute of the surgery, at every minute during the surgery that I'm working with them.
I used to tell my fellows, or I still tell my new fellows now, that if the OR staff say that you're sort of an annoying surgeon to work with because you're so, you are demanding and commanding, but you're the one that they would want operating on them or their family members, I think is always a good thing, and to have that said about you.
Yeah.
So this upcoming meeting in March, the theme that's been chosen is surgeons as change agents. Starhampton's going to be speaking on this. What does that mean to you, and what changes have you seen, witnessed in your career, and what do you envision is in the pipeline?
Well, it's interesting. Like when I started as a coming out of fellowship, starting with Kaiser, starting with SGS, my three overarching goals for change were high volume surgery, urogynecology specialists doing urogynecologic surgery, and more vaginal surgery. And it's been really grateful to see that, both SGS as part of the national conversation, and then with the work that I did personally working with Kaiser, that, well, as Meatloaf said, 2 out of 3 ain't bad. So the one thing that unfortunately I think I see the change going forward is that vaginal surgery is going to become a relic at some point, and that everybody's doing robotics, which it's not necessarily the best thing for the patient, in the sense that it works, right? It's pretty nifty, but it's just one of those things where we spend a lot of money and we don't get any better outcomes, I tell my residents, yeah, it's the American way, right? Spend a lot of money, don't get better outcomes. And I see the, in Uro-GYN in particular, and in GYN surgery in general, that the number of robotic cases is continuing to increase. Residents are only being trained in robotic surgery. And so maybe in the last couple of years before I pull the plug in 2 years and 3 months, then I will, maybe we can do something to try to push forward the concept that, yes, you can take out a uterus without having to make incisions on people's bellies.
I hear you. Given my training, I haven't had robotic privileges in 7 years, and but yes, the trainees are coming out of residency strongest on the robot, which is interesting, right? It's a complete sort of shift in
Yeah.
paradigm for sure.
Yeah.
And you are sharing sort of very similar concerns,
Yeah.
and not surprisingly, amongst all of the vaginal surgeons, I've talked to Mickey Cram and Mark Walters,
Yeah.
and John Delancey. It's similar.
Yeah.
So you've already mentioned this, but I don't know if you wanted to sort of say it in a
Mm.
different way since I gave you the questions ahead of time.
Mm.
But the role that SGS has played in your career.
Well, I mean, it's enabled. I mean, I never really practiced in academic setting, and so it enabled me to be part of academia and part of at least a small part of the conversation nationally about the things that I discussed that I'm passionate about. High volume surgeons, trained surgeons, specialty surgeons. All the things that really enhance outcomes for our patients. And I was really grateful and honored to be able to be a part of that. Because I mean, otherwise, obviously there are people who can come through Kaiser and really make a difference nationally, but it's not easy to do because you don't get any time to do that. Kaiser has you have a certain role, and one of them is not to be part of any national committee. And so it was really, that I was able to do this was really, I'm very grateful for that opportunity.
What keeps you now coming back to meetings? So you've contributed from a leadership standpoint, but what gets you back to the actual meetings themselves?
The people. It's just it's a great group of people. We have a great time. I didn't get a chance to go to AUGS this year or SGS last year, but relative to the two national meetings that I would attend, I really am drawn to the science at SGS, the surgical focus of SGS. All my friends are there, and I've, I like after I finished up as president, I walked out of my, you get 1 year as the past president, and then you walk out of the room, and I'm like, oh crap, I'm never going to be back here again. It was like a sad day. And so how do I get back into that room? And so I actually volunteered to help with fundraising. So I'm running the fundraising committee now. So I'm back. I love this, and I'll keep working with SGS until, basically I can't work with SGS. I'm not physically capable of it anymore. So I figure you guys got me for at least a decade or two,
Yeah, I was going to say you're now very committed for quite some
I'm in.
time.
Yeah, I'm in. So.
Well, you mentioned, I didn't send this to you ahead of time, but I've asked some people. You've mentioned that retirement is sort of around the corner. What is retirement going to look like for a gynecologic surgeon like you?
Well, it's not really retirement. I can't. I got my daughter's a sophomore in high school. My son's a sophomore in college. I'm not retiring anytime soon. But what I will get the opportunity to do, to wit our prior conversation, is that I want to teach. And so I send you that note about, well, maybe San Diego, there's opportunities here in Sacramento, UC Davis and Sutter starting a residency. Financially, it would be best to get out of California. So maybe look at elsewhere in other states. Well, where can I don't want to work full time, but I want to be able to teach and even potentially do research. And I would do that until, again, I'm not physically capable of doing the work. So that's the goal. But just, at age 60, when I can, retire from Kaiser at full benefit, it's like, it'd be hard not to take the opportunity to then get into a scenario where I can, pursue that side of I get to teach a little, but I really want to teach full time. Maybe even teach vaginal surgery,
Well, that was sort of part of Mark Walter's mission in the last, I caught his last 10 years of practice, as his trainee and then afterwards as his partner.
Mm-hmm.
And that was sort of his last mission, no leadership, no administrative roles. It was simply teaching a generation of learners what he knows best, right? And participating in educational activities that also sort of enhanced his last 10 years of practice, which I think was a great way to go out. So I know he left with energy. Like he went into retirement with a lot of energy. So just something to think about.
Yeah.
Any specific SGS memories that you want to share with the group that might get clipped out?
Yeah. Well,
Anything that comes to mind?
my favorite one was doing the presidential address. I mean, to me, it was, again, I was so honored to be able to be in that position of being president. And I put forth a tremendous amount of effort to write a speech that was reflective of me personally and what my goals were. And, most of the time you write a talk and it's, you get there and it's fine. But that one was just from my soul. And I still review that speech on a regular basis, just like I love that talk. It was just so, so reflective of who I am and what I wanted to do. And so that's without question my favorite memory. That and secondarily was I was the one who interviewed Nancy to hire her, and so that one that one had the most impact. was when I spoke with Nancy, I went to the group and I'm like, yeah, that's right there, and so that was probably the most impactful from the group perspective. But the favorite memory for sure was giving the speech. I love that speech.
A lot of these, it's funny, some of the speeches, there are some that stand out, and this isn't to blow smoke in any way, but I know why you loved your speech. And so I think I love that was that, a lot of people have talked about sort of memories with people and some funny things that have happened, but the fact that it was just as meaningful to you as the people that it landed on, I think is impactful.
Well,
so
when I was talking about my daughter and I'm crying and I'm looking at the audience and there's probably 100 people crying, I'm like, oh yeah, this
yes, exactly. All right, last, tell us your favorite surgical instrument and why.
Well, the vaginal Bookwalter, of course.
Yeah,
so and then actually, so that like when I walked into my first day of fellowship, it was surgery with Dr. Magrina. And I was, you had to, how you have, like, you start your first day, you got to go get your badge and whatever, so I walk in just as the case is starting, and I see him assembling the Bookwalter, and I see him put the blades in, and my first question was, why the heck didn't anybody ever show this to me? Why have I been holding retractors all this time? What is this miracle device? And then it's been, obviously it's been a game changer when it comes to hysterectomy. And then with Dr. Maddox and myself, we then developed what we like to call the Lone Walter retractor. Not because my last name's Walter, but because we took the metal Lone Star blade, or metal Lone Star ring, and amalgamated it with the Bookwalter blades. So for post hysterectomy cases, we use the Lone Walter, and that's my second favorite instrument. So because it's the hooks and the blades, and you can get them in. It just makes. I always tell the residents, I'm like, can you imagine trying to hold retractors like when I was a resident, I had to, and
yeah.
Now we've basically eliminated you holding retractors. So now you can actually like see what we're doing. So
Roseanne Coe used to operate next door to me when she was at Cleveland Clinic. We had the same OR day, so I would come over and watch. And I interviewed her actually early this morning, and I asked her the same question. I said, but you're not allowed to say the vaginal Bookwalter, because I knew she was going to say it, and she got a little miffed at me and still. I
said it. So, I had the exact same experience. Just, I think she's probably 5 or 6 years after me in fellowship, but I'm sure when she saw it for the first time, she was like, oh, why doesn't everybody do this? Yeah. So.
Well, it's amazing how much learners learn also when they're not actually having to muscle something and sort of like position themselves in an uncomfortable way. If they can actually see what you're doing and they're helping you with, it's actually a different experience for them.
Oh, absolutely.